Officials in Southeast Iowa want to bridge the gap between health care and community resources.
And WGEM Shakayla McCamick joins us with details on how that is happening in Lee County. Shakayla.
Mackenzie and Daniel, in August, the Lee County Health Department received more than a $500,000 grant from the Health Resources and Services Administration. They used that money to create a free public health course that allows students to learn what resources are out there for better patient treatment and referral. Recent retiree Angela Salazar used to work for the Centers for Disease Control and Prevention in Atlanta, Georgia.
I worked around the world in Ebola and immunizations, hurricanes response, a lot of different places, a lot of different countries.
She was born in Mexican Village in Fort Madison, where most of the people she knows are older and facing health issues. Now she wants to be able to help those who might not know the resources that are available to help them.
There's a lot of elders. People came in the early 1900s, but the oldest residents are probably in their 90s. I want to be able to provide them resources and information.
The Lee County Health Department is partnering with Southeastern Community College in Fort Madison to train people like Salazar who want to bridge the gap between people and healthcare resources in the community. Community Outreach and Development Project Coordinator Brianna Kramer says federal grants allowed the health department to create the curriculum for the 8-week certificate. The almost $500,000 grant also allows students to take the course for free.
Sometimes access and just understanding what's happening in the healthcare world can be really hard to just grasp. And so we imagine community health workers kind of being that bridge and that translator for people, help them advocate for their health, help them advocate for themselves, and find out where best to go.
So should you take this course, how can you help your community?
It can look like peer recovery support. It can look like you volunteer in your church ministry and you just want to better help people with their health. It can look like a community health worker position directly in a hospital system. There's a lot of different ways that you can use this information and this knowledge.
Students taking the course will complete 64 hours of in-person lecture and 16 clinic hours before receiving their certificate at the end of this month. Shakayla McCamick, WGEM News.
All right, thank you, Shakayla. And there is still time to sign up for the March cohort of the Community Health Worker course, and you can find out how to register on WGEM.com.